So thank you so much. And now it is my great pleasure to introduce you to today's presenter. Carrie DeJong is a Vancouver-based therapist, consultant, and writer with over 20 years of clinical experience working with trauma and addiction. She focuses on bringing greater awareness of the impact that trauma, stress, and mental health challenges have on the use of mood-altering substances and behaviors as a way of coping. Her therapeutic practice is driven by curiosity and rooted in mind-body approaches to trauma and addiction. Carrie likes to say, I'm curious about why we struggle, but I am more curious about how we heal.
Great. Well, thank you, Dawn. And I am so excited to be part of this Mental Health Monday and really excited to get to share some of the things that are most important to me in terms of, as Dawn said, one of the things I'm really passionate about is that overlay of trauma and addiction. And there is so much that we're learning about that it's such a privilege for me to get to share. So here's where we're going today. So just a little bit about me. I'm a registered clinical counselor in the province of British Columbia with a lot of experience and expertise in trauma and addiction. I'm both a writer and a blogger and mostly sharing information about trauma and addiction and stress and all of those ways that we see those things show up in addiction disorders and in just the general dysregulation that we experience. I'm also somebody that I would call myself a neuroscientist or a neuroscience geek. I am fascinated by what we're learning about the brain and how the brain and body are wired. And so these are some of the things that I'm bringing today. And you'll also notice I use a lot of macro photography pictures in my PowerPoint presentation. And I use it as a metaphor. It's an invitation to look closely and see things that maybe we haven't seen before. And I hope that that's true for you in this seminar this morning, that as we talk about these two really important topics of trauma and addiction disorders, that as we take a closer look, you'll get to see things you didn't know. And maybe it'll shift the way that you see yourself or other people in your life that are struggling with either or both of those. So here's where we're going today. We're going to talk a little bit about the Adverse Childhood Experiences Study, this fantastic study that tells us a lot of really great information about this topic. We're going to explore what trauma is, the categories of trauma, what trauma symptoms are, and then why people self-medicate. What is that connection between trauma and addiction? And I really appreciated, Dawn, that you just reminded people that if these are hard things, that it's so important to reach out for help to your community, to your professional community, because these are important things that we get support through. And that we need to have that kind of support in order to heal, which is why I get so excited about organizations like She Recovers, because there's such a sense of community that is so vital to the recovery process. So let's talk about a little bit about why this topic is important. Why do we even need to have a webinar on it? And here's one of the pieces that I always say. The problem is the problem. And what do I mean by that? I would say we often treat addiction as the problem, and I don't think that it is. Addiction disorders are just a symptom of the problem. And in my experience, that I think trauma is actually the problem that we're not addressing or understanding in its fullest way. And that addiction disorders and nervous system dysregulation are really just a symptom of the problem of unresolved trauma. So here are some stats that I think are really telling, that are important to understand. Why, when we think about this overlay of trauma and addiction, what are the stats that help us understand how significant this is? So let's talk about post-traumatic stress disorder for a minute. That in the general population of North America, the rate of PTSD, of post-traumatic stress disorder, is about 7%. At some point in time, 7% of the population of the United States or Canada will experience post-traumatic stress disorder. And, in places, for example, like Manhattan following 9/11 in New York, the rates of PTSD are higher, but 7% is about average. But if we look in addiction treatment centers and in treatment centers that are treating substance use disorders, the rates of post-traumatic stress disorder go up to between 36 and 50%. That's a really significant statistical increase. Or then we can look at the other study that I've quoted there, the comorbidity study. And that simply is the term that means when somebody has one disorder, how often or how likely is it that they'll have another disorder? And that statistic is really interesting, that 46% of people with a substance use disorder also have PTSD. Or if you have PTSD, 46% of you will have a substance use disorder. So these two studies or stats alone tell us that this is a really valuable and important thing that we need to be understanding when we start looking at what is causing addiction disorders and substance use disorders. And this might be a piece that's contributing for people and they don't even know about it. So I wanted to share a little bit about the Adverse Childhood Experiences Study. And this is, it's also called the ACE study. And doctors Vincent Felitti and Robert Andon, this was, I think in the 90s that this survey was done. And they kept seeing this correlation between adverse childhood experiences and people that struggled in a weight loss program trying to lose weight for bariatric surgery. And they kept hearing that the people that struggled had challenging childhood experiences and a lot of trauma. So they developed this study where they eventually surveyed 17,000 adults. And they had identified 10 different types of trauma. So they looked at, as you look over this list of these 10 different types of trauma, I will say right off the bat, these aren't the only kinds of trauma people experience, but these are the 10 that they identified for this survey. So they took a look at physical and emotional sexual abuse, physical and emotional neglect, domestic violence, parental addiction, household mental illness, an incarcerated family member, and parental separation or divorce. And then they asked, how many categories of these ACEs did you experience? Not how many times you might have had that experience of physical abuse, or it was just how many categories, how many of these 10 categories did you experience growing up? And that's your ACE score. So then they started doing some correlations to see what happens so that somebody with an ACE score of 4 compared to somebody that had none of those 10, they were 5 times more likely to, I can't even see what that one is, but that's okay. They're 7 times more likely to have addiction. They're 10 times more likely to use illicit drugs, and they're 12 times more likely to experience a suicide attempt. So that starts telling us that somebody with 4 of those categories starts having a much more significant experience with mental health challenges and with substance use challenges. So here are some more statistics, right? So if we look at these comparison stats, these 3 separate categories, the first one is 33% of the population reported no ACEs. And when they have no ACEs, you can read the statistics about how many smoke or have alcoholism or use IV drugs or suicide attempts. But then as we move the next level over, 51% of the population reported 1 to 3 ACEs. And with 3 ACEs, you start seeing the rates of smoking and alcoholism, of IV drug use increases, and suicide attempts increase. And then there were 16, what you might not be able to see is with 7 or more ACEs. This last one is 7 or more ACEs. And now 1 in 6 smokes. 1 in 6 has alcoholism. 1 in 30 uses IV drugs. That's a 4,600% increase from people that have 0. That tells me something really important. And then 1 in 5 attempts suicide. When we talk about suicide prevention, one of the things that I think is most important to be talking about is trauma resolution and healing. That if we're not healing the trauma, we're not actually helping people who are feeling so despairing and so hopeless. So This ACE study says some really important things about the connection. When we've got a lot of unresolved adverse childhood experiences, there are some significant impacts on substance use and addiction disorders. So let's talk a little bit about what trauma is. How do we define it? Because a lot of people think that what's happened to them isn't trauma. And I think it's really important to start having a clear definition of what trauma actually is. So these are some different ways that we can understand it, that trauma is any event that overwhelms the central nervous system. And it remains unresolved, and it alters the way we process and recall memories. And it has a negative impact on day-to-day interactions and activities. And I know that's kind of a maybe a different way of looking at it. I'm even going to share something else that two of the people that have really informed my way of understanding trauma. I love the work of Peter Levine and Bessel van der Kolk. And, this is what Peter Levine says about it. He's the somatic experiencing person that's developed body-centered psychotherapies, and one of the people that really revolutionized our way of understanding the mind-body connection in trauma. And Peter Levine says it's about the nervous system's response to an event. It's not necessarily the event itself. And so, in other words, trauma isn't about what happened to me. It's about my nervous system's response to it. And as Bessel van der Kolk says, trauma is not the story of something that happened back then. It's the current impact of that pain and horror and fear living inside of people. And so here we start getting a bit of a different view of how we might come to understand trauma. And I love the nervous system perspective. So I thought it might be helpful to give you just an understanding of what we mean even when we talk about the nervous system. And essentially it's our operating system. It's our human operating system. A lot of us probably know more about the operating system of our laptop or our phone than we do about our own. And why is it so important? It's because it's responsible for everything. It's responsible for thoughts, memories, sensation, movement, and it governs all of the systems in our body. And our nervous system is phenomenally impacted by traumatic experiences. And then our nervous system retains or remains in that activated state for days, months, years following traumatic events. And it's about that impact in our nervous system that we're exploring. So here's, when I talked about just a little while earlier, those 10 ACE categories, and I said they're not the only types of trauma that exist. Here's another way that we can even understand trauma. I'm going to walk us through 6 different categories. And the first one are medical and dental traumas. And I'm really grateful that we live in a modern culture where we have access to surgical procedures and dental procedures that are often life-giving and life-saving. But they can be a level of trauma in our system. Just because we ended up fixing a problem doesn't mean the actual surgical procedure wasn't traumatic to our body. And so we can start to understand that adds something to our trauma load. And then we also need to start including high impact traumas, things like car accidents, concussions, falls, because again, they rattle our nervous system. And that again adds a load. Then we can talk about the third category, which is the relational traumas. And all of the ACEs, all of the adverse childhood experiences in that study are relational trauma, but it also includes things like assaults, bullying, intergenerational trauma, and anything that happens in the context of relationship that's traumatizing. And I should also mention that these 6 categories are moving from least disorganizing to things that are most disorganizing on our nervous system. And I'll talk a little bit more about that in a minute. So then we move on to the last 3. And the 4th category that I wanted to talk about are the social justice traumas, the things that we're really seeing in an important way in the last few months, the impacts of racism and poverty and discrimination and systemic oppression. And that adds another layer of trauma for people for whom those experiences have been significant, whether it be the indigenous populations, Black people, cultural experiences of racism and oppression. We really need to hold that these types of traumas have such a profound impact on the nervous system of the people that experience them. Then we've got the fifth category, which are developmental traumas. And these are capacities or compromised learning and growth capacities due to early childhood trauma. So when we're developing as children, we are learning a lot, and a lot of really important aspects of who we are as people are coming online. And when we've been exposed to early childhood trauma, particularly those 10 ACEs, we have a hard time learning things like emotional regulation and attachment and how to have a sense of will or autonomy or all kinds of different things. And so when we have early childhood trauma, it sets us up to have struggles moving forward that are another way that trauma manifests itself. And then the sixth category are global activation traumas. This is when, it's kind of how I want to explain that, is when our nervous system is lit up like a Christmas tree and we are in this place of profound trauma that we can't be there till we're not there. And it includes things like near drowning, seizures, psychosis, overdoses, high fevers, and a lot of the kinds of traumatic experiences that are in significant addiction disorders like seizures, psychosis, overdose. That's really common in the population who are recovering from substance use disorders. So I just mention that because that adds a real layer of disorganization to the nervous system and presents additional challenges for people that are recovering. So let's move on from these six categories and just briefly touch, how do these experiences impact us? What are the symptoms of trauma? And we know that we've been traumatized because we display or experience the symptoms of trauma. So let's take a look at what they are. And I bring back this slide because trauma isn't about the event, it's about the nervous system response, right? Trauma is not the story of something that happened, it's the imprint of it. And remembering again what our nervous system is, that it's our operating system, that it's responsible for all of these important things, thoughts, memories, sensations, emotions, and it governs everything else in our system. So with that knowledge, let's start looking at what the impacts, what are the symptoms of trauma? And I like to put the symptoms of trauma into three different categories that help us make sense of them. The first category is that we have too much of something. The clinical word for that is hyperarousal symptoms. And so there are too much of things. The second category is now there's too little of certain things. And the clinical term is hypoarousal. And then the third category is the ways that trauma disrupts our sense of self. So let me talk a little bit about these three, just to give us a bit better of an understanding of what I'm talking about. So when we talk about the too much symptoms, the hyperarousal symptoms, we're talking about nervous system arousal. The fight or flight response has been triggered in our nervous system, and it hasn't resolved itself. So we experience things like being easily startled, or we carry tension. We can't sleep because our system is on and, it's in that activated state. And so sleeping becomes difficult. Or hypervigilance is the term that we use when we talk about constantly scanning the environment for cues of danger. And when people have a hard time letting themselves relax, because they're scanning, that's about nervous system arousal. The second thing I've listed on this page is just unmanageable emotions. People experience mood swings or significant anxiety or fear, or they have anger or rage. When we think about the responses to a traumatic event, we either want to fight, flee, or freeze. Those are the three most common. And the fight or flight response is really about anxiety or fear. It's really about anger or rage. And it is understandable that when we have unresolved traumas, that we have these kinds of big, too much of these emotional experiences. And then there's too much of what are called intrusive symptoms, things like flashbacks and nightmares and trauma triggers and painful memories show up. And now we have no way of getting rid of these things. They're unbidden and they show up all the time. And they happen too much and contribute to the ongoing state of dysregulation and unsettledness. And then there are the too little symptoms. So now this is the way our body moves into the freeze response. Our nervous system starts to shut down things because it's been so painful. And we disconnect from our own feelings and memories, from our own body. We disconnect from other people around us. We start avoiding things that trigger. There's an experience of depression or despair. When we're in a trauma response, our thinking brain has a hard time staying online. So we now have difficulty concentrating, and learning is difficult, where we experience things like dissociation, that disconnection from self, or a sense of numbness or emotional constriction, or it just feels really much easier to pull in and isolate. So these are just some of the symptoms that we start seeing that are too little, and the shutdown experience. And then the disrupted sense of self, that experience of helplessness. I can't do anything to stop this. Shame and inadequacy. If there's one common feeling that I see for people that have that unresolved experience of trauma, it's this profound sense of unlovability and shame and inadequacy, and I'm fundamentally flawed. And that is a trauma response. And then when we start having these negative beliefs about ourselves, whether it's about what we deserve or what we are to blame for, or what we're not allowed to ask for in relationships, there's these negative beliefs about self. Then we also have this real disconnection from our own body and our own sense of knowing what is good and right and what helps and what works. And then we also have a difficulty in knowing ourself because we are disconnected from our own self. We have no idea what we like or what we don't like, or what makes us uncomfortable, or what our boundaries or our limits are. So it has this cascading, way of impacting our lives on so many different ways and different levels. And so here's where we start trying to make sense of that trauma addiction connection. Why is there such a significant correlation between people with a trauma history and substance use disorders? Because they're self-medicating. Why wouldn't you want something to help you manage all of those painful trauma symptoms that I just identified? And we've lived in a world that has profoundly been unwilling to recognize the impacts of trauma, and unwilling to pay attention to how problematic it is for people. And so we've done a lot of focusing on just the addiction, saying this is the thing people need to deal with, because we haven't been willing to pay attention to how important trauma is. And that most people with addiction disorders are just self-medicating all of those painful symptoms that they've never had the help or the support in dealing with. And so that's why I get so thrilled about opportunities to do this kind of educational piece, and for trauma-informed and trauma-sensitive yoga practices, and supportive groups that are trauma-informed, and therapists that are informed in ways that help people resolve this, because we are wired to heal from trauma. That's what I get so excited about speaking into, and for that opportunity. And I come back to that piece. The problem is the problem. And for anyone for whom unresolved trauma is part of the problem, I so hope that this might help you have some new information that helps you move forward in getting support and, the help and the professional help, the support groups around you that help you move in the direction of addressing this. And Vincent Felitti, one of the people that created the ACE study, he says this interesting thing: it's hard to get enough of something that almost works. In other words, substance use is never, ever gonna work because you can't get enough of it to really work. And so here's the invitation to maybe pay attention to some of the things that are contributing. So this has been a bit of a whirlwind about trauma and the trauma addiction connection. And I'm just going to stop sharing my screen and come back, and we'll go from there. I can't hear you, Dawn.
No,
Oh,
too many buttons to change.
There we go.
Thanks, Carrie. That was great. Just a great refresher for me. I mean, I remember the first time I heard about the ACEs study. It was, maybe about 8 years ago, and it was actually at a treatment center here on the West Coast. They had an education day, and I was just flabbergasted that I didn't know anything about the ACEs study. Yeah. So, and when I've shared about it since, when Taryn shares about it in her trainings for trauma-informed yoga teachers, or just talking about trauma to our community, what I'm always struck by are the power it has, the impact it has on people who have been struggling with, for instance, addiction, whether that be to a behavior or a substance. Yeah. That it finally kind of, something clicks in, and it absolves some of that huge self-loathing and self-responsibility for why we are the way we are. It's like, oh my gosh, there's actually a reason here. There's actually something happening in my brain that makes me this way. It's not because I'm a bad person. It's not
absolutely
because, yeah.
Yes.
So I want to just talk a little bit, if you, now that we have this understanding, what are some of the ways that people do begin to heal?
The biggest piece that I can say about how we heal is we start learning how to calm our nervous system down. And that happens in so many different ways that we used to think that trauma recovery processes were about retelling the story and healing through cognitive ways of understanding what happened to us. And the more we learn, the more we realize anything that calms our nervous system down can help. And because everyone is different, our nervous systems are different, what helps is going to be different. And so I always encourage people to find what works for you, right? And it's things like, what are some of the things that calm our nervous system down? Yoga. Yoga is really profoundly helpful for that. Things like breath exercises, walking, experiences of things like gardening and art. And neurofeedback and EMDR are also good for doing, for helping calm our nervous system. So it's really that trying to figure out how my system gets a little bit more settled so that I can move out of that state of fight, flight, or freeze is the way that we understand it. Polyvagal theory, the work of Stephen Porges, is also something that really informs my work. And there's a lot of incredible information that polyvagal theory helps us understand about how important people are, healthy people and safe people are on our journey of recovery. That's also something that I would say is really important. My website, carriedejong.com, is the easiest way to connect with me. And again, there are some blog posts that I've written that are about the trauma addiction connection, about the adverse childhood experiences study. I've also developed something that I call the vortex model of addiction that really looks at just the chaos that gets created and how it ends up creating a whole pile more challenges the more deeper that we get into that vortex. And so that might be interesting for some people.
For those of you who don't know, the She Recovers Foundation is a 501c3 nonprofit public charity in the US. We're in the process of applying for Canadian charitable status. We connect, support, and empower women through our virtual platforms and in-person community networks. If you feel inspired to become a supporter, please visit www.sherecovers.org. We are all recovering from something. If you are a woman, cisgender or trans, or a non-binary individual who identifies with women's communities, and if you are in recovery or seeking recovery, you are welcome here. Please note, we are not a 12-step recovery program, but we support all recovery pathways and criticize none.